Okay, let's dive into iliotibial band syndrome, ITBS, right?
That's the one.
That really nagging pain you can get on the outside of the knee, especially like during or after exercise.
Exactly. So many people experience it.
Yeah, so today we really want to cut through the noise, get you the essential info you need to, understand and remember ITBS for revision.
Yep, we'll break down what it is, the why, how to spot it, and importantly, what can be done.
Think of it as your personal cheat sheet. So let's start right at the beginning. What exactly is ITBS?
Okay, so ITBS is a really common overuse injury. It involves that thick, fibrous band of tissue running along your outer thigh that's the iliotibial band.
Right.
The problem starts when that band repeatedly rubs against or gets compressed by a bony prominence on the outside of your knee, the lateral femoral condyle.
And that friction causes the pain.
Precisely. That friction leads to irritation, inflammation, and ultimately that lateral knee pain. It's especially common in athletes or anyone doing lots of repetitive leg movements.
Okay, so that's the what. Let's talk about the why, the etiology. What's actually causing that rubbing?
Well, it's usually not just one single thing. It's often a combination. The core issue is that repetitive friction and compression during knee flexion and extension, like when you're running or cycling.
But there are things that make it more likely, right? Contributing factors.
Definitely. Think biomechanics, things like excessive footpronation, where your foot rolls inward too much,
Okay.
or maybe a difference in leg length. Poor training techniques can play a big role too. And muscle imbalances, particularly weakness in the hip abductor muscles. It's often multifactorial.
Right, so a mix of how you move and how you train. Who tends to be most at risk then?
Well, as you might guess, it's people whose activities involve a lot of repetitive knee bending and straightening.
Like runners and cyclists.
Exactly.
Yeah.
Long-distance runners and cyclists are particularly susceptible. Also, watch out for sudden spikes in training intensity or volume.
The too much too soon problem.
Precisely. Skipping warm-ups, inadequate stretching, and as we mentioned, those underlying structural quirks in the lower limbs can all increase your risk.
Okay, let's zoom in a bit more on the pathophysiology. What's happening inside the tissue?
So it really boils down to inflammation and irritation. That constant rubbing and compression causes tiny injuries, what we call microtrauma, to the IT band, or the tissues underneath it.
And the body reacts to that.
It does. It triggers an inflammatory response. Over time, this chronic inflammation can actually cause the IT band itself to thicken, which can sort of perpetuate the problem and contribute to that persistent lateral knee pain.
That makes sense. Now, someone comes in with pain on the outside of their knee. It sounds like ITBS, but could it be something else? What are the differential diagnoses we need to consider?
That's a crucial point. Lateral knee pain isn't unique to ITBS. We absolutely have to think about other possibilities.
Like what?
Well, there's patellofemoral pain syndrome, often called runner's knee. That's a big one. Also, a tear in the lateral meniscus. Or maybe bursitis, which is inflammation of a bursa, one of those little fluid-filled sacs near the joint. A stress fracture in the femur or tibia is possible, though less common.
Anything else?
Yeah, you even need to consider referred pain, maybe from the lumbar spine or the hip joint. So getting the diagnosis right is key. You can't just assume.
Absolutely. How common is this condition overall? What's the epidemiology look like?
It's hard to pin down exact numbers, say specifically for the UK, but ITBS is widely recognized as, well, a very common issue, especially, as we keep saying, in athletes and people doing those repetitive lower limb activities.
So common in runners and cyclists particularly.
Very common in those groups. It affects people across different ages and both sexes, though, so pretty widespread if the activity fits.
Okay. Let's talk about how it actually presents. What are the classic clinical features? What would someone feel?
The absolute hallmark sign is that lateral knee pain. It's often described as a sharp, burning, or sometimes stinging sensation right on the outer aspect of the knee.
And it gets worse with activity.
Typically, yes, especially activities involving that repetitive knee movement. Running downhill or going downstairs are classic aggravators
Why downhill specifically?
because the knee tends to be straighter for longer during the stance phase, increasing the time the IT band is potentially compressed or rubbing over the condyle.
Got it. Any other symptoms?
Sometimes people might notice a bit of swelling in the area or even feel or hear some snapping or popping around the outer knee. But the pain is the main feature. Think lateral knee pain, worse with repetitive flexion.
Right. How do doctors usually confirm it's ITBS? What investigations are done?
Honestly, a good clinical history and a thorough physical examination by a healthcare professional are often enough to make the diagnosis.
What kind of things would they do in the exam?
They'll palpate the area for tenderness, usually over the lateral femoral epicondyle. There are specific tests, too, like Ober's test for IT band tightness or Noble's compression test, where they apply pressure while moving the knee to reproduce the pain.
Is imaging ever needed, like an X-ray or MRI?
It can be. Usually it's not needed to diagnose ITBS, but more to rule out those other potential causes we discussed, the differentials, like a meniscus tear or a stress fracture. Ultrasound might sometimes show thickening of the IT band or fluid collection.
Okay, so mostly clinical diagnosis. Now, the crucial part, management. What's the plan if someone has ITBS?
The mainstay is conservative management. That means, first off, activity modification. You need to reduce or stop the activities that are causing the pain, at least temporarily. Rest is important.
Makes sense. Stop irritating it.
Exactly. Then, physiotherapy plays a big role. Focus on stretching, particularly the IT band itself, but also the glutes and hip flexors, and crucially, strengthening exercises.
Strengthening what specifically?
Well, especially the hip abductors like the gluteus medius. Weakness there is often linked to ITBS. Core strengthening is usually helpful too.
What about things like orthotics?
Yeah, orthotics or shoe inserts can be helpful if there are underlying biomechanical issues like that excessive pronation we mentioned earlier. Assessing footwear is important too.
And for the pain itself?
Over-the-counter, non-steroidal anti-inflammatory drugs, NSAIDs, can help manage the pain and inflammation in the short term.
Are there other options if that doesn't work?
For more persistent cases, sometimes a corticosteroid injection into the inflamed area might be considered. Surgery is really a last resort, very rarely needed, perhaps to release part of the IT band if everything else has failed for a long time.
Okay, so mostly conservative. What's the outlook generally? What's the prognosis?
The good news is that the prognosis is generally quite positive with appropriate conservative treatment. Most people respond well.
So they can get back to running or cycling.
Yes, the majority can return to their previous activity levels. Recovery time obviously varies depending on how severe the symptoms are and how long they've been going on.
How well they stick to the rehab.
Absolutely. Adherence to the treatment plan, especially the exercises, is key. And addressing those underlying factors, the biomechanics, the training errors, that really improves the long-term outcome and helps prevent recurrence. Early intervention is better.
Right. What happens if someone just tries to push through the pain or doesn't manage it properly? Are there complications?
There can be. If ITBS isn't treated or is managed poorly, it can definitely lead to chronic persistent pain. That can significantly limit activity and impact quality of life.
And affect performance.
For sure, it can hinder athletic performance. Plus, if you're compensating for the pain, you might alter your gait or movement patterns, which could potentially increase the risk of developing other lower limb injuries.
Yeah.
So, avoiding it getting chronic is important.
Okay, that makes sense. So to wrap up for everyone revising out there, ITBS means lateral knee pain, often sharp or burning, worse with repetitive activity like running downhill.
Remember, it's an overuse injury, friction between the IT band and the bone. Think biomechanics, training load, muscle imbalance as key factors.
And management is usually conservative. Rest, modify activity, stretch, and especially strengthen those hip muscles.
Exactly. And the outlook is generally good if you address it properly and tackle those underlying causes.
Brilliant. Hopefully this deep dive has given you a clearer picture of iliotibial band syndrome and some solid points for your revision.
Remember those key features and the importance of ruling out differentials.
And for more in-depth revision resources, loads of practice questions to really help you nail down your understanding, do head over to passthemsra.com.
Yeah, definitely check that out. And there are also even more free learning materials available at freemsra.com.
Great resources, so keep up the learning and keep moving.